Hello. Today I thought instead of speaking on a particular type of cancer, I will answer few of the questions which people have been asking me frequently. One of such question is, what are the tests one should undergo after the age of 40 or 50 to detect cancer? So this is a very important and pertinent question because we do see a lot of health checks. People are healthy and want to be healthy, and they are health conscious and they are going for health checks. And then what are the tests one should undergo after the age of 40 or 50 to detect cancer? So we can divide tests for men and tests for women. So there are certain tests which are recommended for women, which they must and should undergo after the age of 50 to detect certain types of cancer. One such test is mammogram, which should be done for all women after the age of 50 years, and it should be done every year, and if it is normal in 3 consecutive years, they can do it once in 2 years. So mammogram is a must for all women after the age of 50 years. And of course pap smear is one more test which can detect cervical cancer in women, and it should be done after the age of 21 or after the marriage, whichever is later, and then they should do it every year, and if it is normal in 3 consecutive years, it can be done once in 3 years. So these two are the tests which are recommended for women after the age of 40 or 50. So that can detect breast cancer and cervical cancer respectively. And for men, only test which is recommended after the age of 50 years is colonoscopy to detect colorectal cancer. And also in women after the age of 50, colonoscopy is advised to detect colorectal cancer, and if it is normal, it can be done after 10 years. So it is recommended once in 10 years after the age of 50 years. So there are no other tests which can be done to detect cancer in early stage, and people do ask whether they should do a PET CT scan or a CT scan chest or ultrasound abdomen or some blood markers, tumor markers which we call CA125, CEA, CA19-9. So none of them have been proven to be useful, and then some people do ask whether they should do CT chest if they are heavy smokers. So that also has not been proven till date. So there are no other tests which are recommended to detect cancer in early stage. So the only way we can detect cancers in early stage, and the only cancers which can be detected are breast and cervical cancer in women and colorectal cancer, both men and women. So there are no other tests. We don't have to undergo PET CT scan or tumor markers or CT scan or ultrasound to detect cancer. And of course health checks are required or important to detect your blood sugar levels, your lipid levels, and your thyroid levels, and also blood pressure and so on and so forth, but not for cancer. So the only best way to prevent cancer is to prevent the risk factors or avoid the risk factors which are avoidable, that is modifiable risk factors, that we should have a healthy lifestyle, we should eat healthy, avoid red meat, do not smoke, and avoid tobacco in any form. So these are the ways which we can reduce our risk factor. But as far as screening is recommended, mammogram and pap smear for women and colonoscopy for both men and women after the age of 50 should suffice. Thank you.